A biomarker is an indicator. In particular, it is an indicator of a biological state, a normal biological state, a normal process, or even an indicator of a condition, of a disease. For example, blood pressure, it is an indicator, it is a biomarker of cardiovascular disease. But even body temperature, if your body temperature is over 37 degrees, it is an indicator of some disease, of an infection, for example. So a biomarker is an indicator of biological process or of a disease. And particularly important is that this biomarker is quantifiable. You can measure, so you can understand how strong, how deep is the disease. So you can quantify a biological state or a disease. And in this case, we identify the biological marker, the integrin α5β1, because this integrin, it is expressed by stromal cells, for example, in our body. But in the context of bladder cancer, this integrin is not expressed by the normal urtilia cells that are lining the bladder. So it is completely absent from normal bladder. Indeed, it is expressed only by bladder cancer cells. So this is particularly important because this is a specific biomarker for the presence of cancer cells. And to me, it is even more important because sometimes there are biomarkers that are more or less expressed in diseases. Okay, maybe they are threefold more expressed during the onset of cancer. In this case, the integrin α5β1, it is a black and white situation. It is completely negative in the normal biological state, while it is present only when the cancer cells are present. So in this case, we can identify the presence of cancer cells by looking at this biomarker. So now we can deliver some specific contrast agent or therapeutic agents using a ligand, antibody, a peptide, something that can recognize specifically the marker. And so we can conjugate some drug, some contrast agent to this ligand that we recognize the integrin. For example, a few months ago, we published a paper again in which we discover an aptamer, a short RNA molecule that is specific for recognizing the integrin α5β1. So we can use this aptamer to deliver some contrast agent for doing a diagnostic screening, or we can conjugate a therapeutic agent to this aptamer to deliver a targeted therapy only on cancer cells.